The Calgary Board of Education is warning students, teachers and parents about the risk of measles ahead of the upcoming March break. A letter sent on behalf of Alberta Health Services warns about a significant rise, not just across the country, including Alberta, but also at popular places to visit abroad. Terry Fikowski reports.
Abdul Maditharimbal Gafoor was sick with measles as a small boy growing up in India.
It's not very pleasant. Your face will, bump up.
That's why he's concerned about the recent cases popping up in Alberta.
My kids have been vaccinated, so that's a relief.
With just days until March break at Calgary Public Schools, a warning to parents about the highly contagious disease.
I've seen the message from the school and I was a little bit concerned.
A letter sent on behalf of Alberta Health Services says there are no confirmed cases at schools right now and want to keep it that way. It warns of a significant rise of the virus in Canada, with cases reported in Ontario, Quebec, Manitoba, British Columbia, and more recently Alberta, but also in the U.S. and Europe.
One person can infect quite a large number of other people just by sharing airspace, so it's amongst the most contagious of diseases. And so travel is always a risk.
Alberta is reporting 13 cases, including 2 cases from the same household in Calgary. And the public health alerts have some parents wanting to stay close to home for spring break.
The plan to ban, we have to reconsider it.
Several factors are contributing to the rise in the once considered eradicated viral illness. Some routine childhood immunizations fell through the cracks during the COVID-19 pandemic, but experts say there is a rise in anti-vaccine sentiments.
Measles has unfortunately been the poster child of much of the misinformation about vaccines and really tied to one study which has not only been retracted but has been proven to be completely fabricated.
Vaccine is the best protection against measles, but with less than 70% of all Alberta children fully immunized with both doses, Dr. Jenny says it may be challenging to contain recent cases. Alberta Health Services says if a case is confirmed at a school, it will work immediately to reduce the spread and is urging parents to keep their children home who may develop symptoms, including a blotchy rash, high fever, runny nose, and cough. Terry Fikowski, CTV News, Calgary.
So anyone born after 1970 who has fewer than 2 doses of the measles vaccine is at risk. If you're unsure if you or your child is fully vaccinated, you can check your record by calling HealthLink at 811.